You're watching CTOM TV. Knowledge is power.
So we're going to go over some case examples. And I did mention that there's some differences between adenocarcinomas and squamous cell carcinomas. Typically, squamous cell carcinomas don't always have these mutations that they look for in adenocarcinomas, but that's not always true. Often it's just because we've never looked for them. So we had a patient recently, we'll call him George. He had a squamous cell lung cancer. Doctor had pretty well done everything for him and didn't really have any other solutions for him. So what we did was we did tumor DNA sequencing for him, and we found that he had a MET exon 14 skipping mutation. That's not listed here, but it was a MET exon 14 skipping mutation. So we suggested crizotinib. We also suggested cabmatinib or tepotinib. And then we also suggested following off with cabozantinib. So you don't need to know what type 2 and type 1 inhibitors are, but it's important to understand that type 2 inhibitors will work after type 1 inhibitors fail. So cabmatinib and tepotinib are drugs designed specifically for MET exon 14 skipping. Crizotinib is designed for a different type of mutation, so is cabozantinib, but they're both found to work for MET exon 14. So we provided this information to George's oncologist. So George's oncologist said, well, I can't access cabmatinib or tepotinib because they're not available in Canada. And crizotinib, I'm not allowed to prescribe it because it's not approved for squamous cell. It's only approved for adenocarcinoma. Cabozantinib is approved for a different type of cancer altogether. So, we said, well, let's contact the drug company and see if they'll provide it for free or if they'll provide it for a discount. So we contacted the drug company. Then we had George's oncologist follow up, and he was able to access both cabmatinib and tepotinib for free for George. So George has been on cabmatinib or he's been on crizotinib, and now he's going to get cabmatinib for free and tepotinib. So, you never know until you ask.
Thank you for watching CTOM TV. Subscribe below and stay informed.